Now let us move to discuss the front of the leg and dorsum of the foot. The muscles of the front of the leg are the following: tibialis anterior, extensor digitorum longus, peroneus tertius, and extensor hallucis longus. These muscles are kept within a tight osteophyseal compartment because of the covering thick deep fascia. These muscles are better identified as their insertions because at their origin they form a more or less fused mass. This is the tendon of insertion of the tibialis anterior. It curves on the medial side of the foot to get attachment into the base of the first metatarsal and the medial cuneiform bone. This is the tendon of the extensor hallucis longus, running on the medial side of the dorsum of the foot, down to the base of the terminal phalanx of the big toe. This is the tendon of the extensor digitorum longus, dividing into 4 slips going to the lateral 4 toes. This is the tendon of the peroneus tertius, going to the base of the 5th metatarsal bone. All the contents of the anterior compartment of the leg pass deep to the extensor retinacula. There are 2 extensor retinacula. The superior extensor retinaculum stretching between the tibia and fibula, and the inferior extensor retinaculum, which is Y-shaped. The stem of the inferior extensor retinaculum arises from the lateral side of the calcaneus and bifurcates into 2 limbs. The upper limb is attached to the tibia, and its lower limb is attached to the medial side of the foot. The structures that pass underneath the extensor retinaculum are the following: from medial to lateral, the tibialis anterior being the most medial, then the extensor hallucis longus, anterior tibial vessels, and deep peroneal nerve, and most laterally is the extensor digitorum longus. This is the origin of the tibialis anterior muscle. It arises from the lateral aspect of the tibia. The medial aspect of the tibia is subcutaneous, giving no muscle attachment. This is the anterior border of the tibia called shell. This is the extensor hallucis longus muscle. It arises from the middle 2 quarters of the fibula. Its tendon lies at first lateral to the anterior tibial vessels and deep peroneal nerve, then crosses over them at the angle to come to their medial side on the dorsum of the foot. This is the dorsalis pedis artery. on the lateral side of the tendon of the extensor hallucis longus. The tendon is a guide to palpate the pulsation of the artery during the clinical examination of a patient. This is the fleshy mass of the extensor digitorum longus, arising from the upper 3/4 of the front of the fibula. The peroneus tertius forms the lower part of the fleshy mass of the extensor digitorum longus, and its tendon is lateral to the extensor tendons. This is the deep peroneal nerve and the anterior tibial vessels are running deeply in the anterior compartment of the leg. The deep peroneal nerve is a branch of the common peroneal, which winds round the lateral side of the neck of the fibula. It runs directly on the anterior surface of the interosseous membrane between the tibialis anterior and extensor hallucis longus. Then gradually comes near the surface at the ankle. The deep peroneal nerve, as it enters the dorsum of the foot, divides into two terminal divisions. The lateral division, which disappears deep to the extensor digitorum brevis, and the medial division, which runs in company with the dorsalis pedis artery. To the space between the first and the second toes. It supplies the skin of this space only. Note that the other areas of the skin of the dorsum of the foot are mainly supplied by the terminal branches of the superficial peroneal nerve. The deep peroneal nerve supplies all the muscles of the anterior compartment of the leg as well as the extensor digitorum brevis. The anterior tibial artery is a branch of the popliteal artery. It arises on the back of the leg at the lower border of the popliteus muscle. It pierces the interosseous membrane and reaches the front of the leg medial to the neck of the fibula. Here, the artery is medial to the deep peroneal nerve. The anterior tibial artery runs with the deep peroneal nerve on the interosseous membrane between the tibialis anterior and the extensor digitorum longus, then between the tibialis anterior and the extensor hallucis longus. Near the ankle, it is crossed by the extensor hallucis longus, which comes to its medial side, and the nerve is here lateral to the artery. As it enters the dorsum of the foot, it becomes the dorsalis pedis. The dorsalis pedis artery runs towards the space between the first and second metatarsals, where it sinks through the base of this space to enter the sole of the foot, where it joins the plantar arch. The dorsalis pedis gives off the lateral tarsal and the arcuate branches. The lateral tarsal artery runs on the lateral side and shares in the anastomosis around the ankle, while the arcuate artery runs laterally over the bases of the metatarsal bones and gives off dorsal metatarsal arteries. The dorsalis pedis is accompanied by the medial division of the deep peroneal nerve, and both structures run along the lateral side of the tendon of the extensor hallucis longus muscle. The tendon of the extensor hallucis brevis muscle, which is the medial slit of the extensor digitorum brevis, crosses the terminal end of the dorsalis pedis artery to reach its insertion into the proximal phalanx of the big toe. This is the fleshy mass of the extensor digitorum brevis, lying deep to the tendons of the extensor digitorum longus. The tendon of the extensor digitorum brevis run to the medial 4 toes, but not to the 5th. Its medial slip to the big toe forms run along the lateral side of the tendon of the extensor hallucis longus muscle. The tendon of the extensor hallucis brevis muscle, which is the medial slip of the extensor digitorum brevis, crosses the terminal end of the dorsalis pedis artery to reach its insertion into the proximal phalanx of the big toe. This is the fleshy mass of the extensor digitorum brevis, lying deep to the tendons of the extensor digitorum longus. The tendons of the extensor digitorum brevis run to the medial 4 toes, but not to the 5th. Its medial slip to the big toe forms the extensor hallucis brevis. The tendons of the extensor digitorum brevis are inserted together with those of the extensor digitorum longus into the extensor expansion. The extensor expansion lies on the dorsum of the proximal phalanx. Through this expansion, the muscles are inserted into the bases of the middle and the terminal phalanges.